According to the CDC, flu activity mostly peaks between December and February. And to help avoid a co-infection, it's important to know the difference in COVID and influenza symptoms and their severity. KAMR Local 4 Sade LeRae explains.
People die from influenza every year, and people are dying from COVID. But you're much more likely to have a short-term illness and a favorable outcome with influenza.
While COVID and influenza are both respiratory viral infections, Dr. Rodney Young with Texas Tech Physicians stresses the importance of knowing their similarities and differences.
One feature that we commonly see with COVID is this loss of taste and smell that can frequently occur pretty abruptly. If you abruptly really can't taste things that you normally should be able to taste, or you have no sense of smell, that's very concerning for COVID infection.
On the other hand, Dr. Young says fatigue, fever, chills, diarrhea, nausea, or a dry cough are very common symptoms in both COVID and influenza. Dr. Young also says the timing of these symptoms are important.
Influenza, classically, the onset of symptoms hits you like a ton of bricks. You go from feeling normal to quite sick over a matter of hours, not a matter of days. What we're seeing a lot with people with COVID is that when they get pretty severe symptoms that, they find them to be fairly disabling, even if they stay home the whole time, that oftentimes it's a matter of weeks or longer.
Despite the severity of COVID compared to influenza, Dr. Young says the vaccines bring good news.
COVID vaccinations are quoting numbers like 94 and 95% effective, and that's higher than the numbers we see in any given season with flu vaccines, where we have to guess about how the strains of flu that are circulating are going to change year to year.
In Amarillo, Sade LeRae, KAMR Local 4 News.
And while COVID-19 related deaths in each county are reported on a regular basis, the Texas Department of State Health Services says the only influenza deaths that are required to be reported are pediatric flu-related deaths.